We recognize WHO's important work in the COVID-19 response. However, multi-stakeholderism in global governance, promoted by rich donors, the private sector, and philanthropic organizations, has undermined the WHO and the multilateral system. WHO's state-driven decision-making system must be strengthened, along with ensuring sufficient and flexible financing. COVID-19 has shown that improving global emergency responses is insufficient to deal with this pandemic and prevent new ones. It's urgent to invest in strengthening national public health systems as a universal and comprehensive foundation to realize health for all. COVID-19 has exposed the inequalities between and within countries and the consequence of global disparities in infrastructure, access to health products, income, and power. We can't rely on voluntary commitments and expect that a profit-driven market model, philanthropy, and donations will solve structural health issues. As data shows, inequities in access to vaccines remain unacceptably large, and the COVAX facility has failed to address this. Advances in research and development should be used to increase access and reduce inequities, not to create new oligopolies under patent protection. The pillars of COVID-19 response must include urgently implementing the TRIPS waiver, compulsory license, binding benefit sharing, and support for local production of vaccines, diagnostics, medicines, equipment, and other health products, and supporting national sovereignty in health. To prevent conflict of interest, negotiations for a new pandemic treaty must be premised on meaningful participation of LMICs and the coordinating role of WHO. It should not be based on a global security perspective, focusing solely on identifying and containing cross-border spread of pathogens, but should also ensure the strengthening of public health systems for effective treatment and prevention in all countries,